All right, and it's 10:03, so we'll get started. So again, welcome to today's webinar, a deep dive into the Doula Registry Board. Again, good morning. Just a couple notes about housekeeping. Today's session will be recorded. Drop any questions in the chat or use the Q&A function. This webinar is going to be recorded. And we can go ahead and go to the next slide. All right, so I'd like to take a moment to introduce myself. I'm Stephanie Kennedy, Senior Program Manager on the Policy and Equity team at the Louisiana Public Health Institute, and I also manage LPHI's Family Health Portfolio. And while this webinar is hosted and facilitated by LPHI, it was developed and will be guided and presented by members of the Doula Registry Board. So we have a few featured presenters that I'm excited to introduce. So Michonne Sadiq is the Deputy Director of the New Orleans Health Department with direct oversight over direct service programs, which include maternal and child health programs and the city's community health center. She is a mother of three girls with over 4 years of breastfeeding experience, including 1 year of tandem nursing. She's a graduate of Xavier University of Louisiana and George Washington University Milken Institute School of Public Health. Her personal birthing and breastfeeding, together with her educational experiences, are the driving force behind her work. She's a maternal and child health researcher and advocate, certified lactation counselor, doula, hypnobirthing educator, and Doula Registry Board member. Thank you for being with us, Michonne. Next, we have Miss Nanette McCann. She's a birth doula, postpartum doula, and certified pregnancy health coach. From the Dr. Sears Wellness Institute in May of 2020, she obtained the Pregnancy Health Coach certification. She currently serves on the Louisiana Doula Registry Board as the representative for Region 2. She received her doula training and certification through Sister Midwife Production in New Orleans. In 2024, her second doula certification was obtained with International Childbirth Education Association, where she's currently a member, and she now serves with the Amandla Group as the policy director. A Caring Season Doula is Nanette's company, and the motto is Caring for Women Creating Life. As an independent doula, she can also provide personal pregnancy health coaching from the initial meeting through pregnancy and into postpartum. Beyond attending the birth, she assists with several resources and extends the necessary emotional support for an empowered experience. Thank you for being here, Ms. Annette. And Dr. Victoria Williams. She's a maternal child health professional, advocate, and leader with over a decade of experience in advancing reproductive justice and equitable care. She serves as advocacy director and member owner of Birthmark, where she leads community-driven programs and policy efforts to support families across the New Orleans area, particularly in communities of concern and maternal health care deserts. Dr. Williams is deeply committed to trauma-informed care, maternal health education, and improving outcomes for Black birthing people. Her policy leadership includes co-developing the Mama Plus Health Package, a transformative legislative initiative that contributed to Medicaid expansion and enhanced maternal mental health services in Louisiana. With a doctorate in healthcare administration and a passion for building inclusive systems of care, Dr. Williams continues to shape the future of maternal and child health through advocacy, education, and community engagement. Dr. Williams is also the Doula Registry Board Chair. So just breaking news, Dr. Williams was called into a hearing during legislative session for House Bill 514 this morning. So she may join us a little bit later at the end of our webinar, but let's wish her and all of our advocates luck this morning. So before we get started, we do have a quick Zoom poll. We'd like to know what region of the state you're representing today. So John Mark, can you launch our Zoom poll? And you can either enter your region, I think this is short answer, region, city, parish. All right, we're about halfway there. We'll give it maybe 15 more seconds. All right, I'm going to go ahead and close the poll, but if you didn't get a chance to respond, feel free to leave your location in the chat. So thanks for all who responded. All right, we can go ahead and go to the next slide. So many of us know the benefits that doula care provides and how access to doula services can improve health outcomes for pregnant women and families. It has also become clear that there is still some hesitance from key players to recognize doulas as valued members of care teams. While some of this stems from power dynamics and lack of clarity about the roles doula play, this can also stem from a lack of clarity about standards and oversight for doulas in Louisiana. So by the end of today's webinar, we hope that participants will be able to identify the scope and purpose of the Doula Registry Board and understand the application and enrollment requirements, including the two pathways to registration for doulas who would like reimbursement through health insurance, to also better understand the process to become a Doula Board approved training organization, including providing a minimum of 8 hours of training on the 21 topic areas suggested for a doula training curriculum, to recognize the requirements for renewal of registration, including 20 contact hours of continuing education. Participants will also gain understanding of the types of activities and programs that may be approved by the board to fulfill the continuing education requirements. To understand how to attend Doula Registry Board meetings, expectations of those meetings, and the role of the public. And lastly, identify opportunities for collaboration, including learning between hospital staff and doulas to develop our care team collaboration and coordination. And now I'll turn it over to Nanette and Michonne to ground us in some key terminology and history to frame today's conversation. So Ms. Nanette, you're up first.
Good morning. This all started a few years ago. I'm not the best expert to say about the history of it, but I do know that it did begin with legislation. And I want to say Representative Willard, with a passion to educate himself and understand a little bit more about maternal health and the maternal health outcomes and infant mortality in our state. So the Doula Registry Board became the vehicle that was put into legislation and became the standard or the agreed upon route for how to get doulas listed in the state who want to practice and who want to be reimbursed by insurance. The definitions we have here, it's included into the, is it called the administrative codes, the LDH administrative codes? I think, but these are the definitions within those codes. The board, the Doula Registry Board, the board appointed doula training organization, the entities recognized and approved by the board for training and certifying doulas, contact hours, 60 minutes of participation in an organized learning experience. Department is usually referring to LDH. Doula is described as an individual who has been trained to provide physical, emotional, and educational support, but not medical or midwifery care to pregnant and birthing women and their families. Hospital facility or entity licensed by the Louisiana Department of Health. Louisiana Doula Registry, the board's listing of people who are in the database who have registered, put in applications and registered. Professional boundaries, the limits of the professional relationship that allow for safe therapeutic connection between the doula and the client. Registrant, the individual listed on the Louisiana Doula Registry. Training, the receipt of education or instruction regarding the development through practice of skills and knowledge related to competency. Benefits of doulas in maternal health care. Well documented, doulas are trained to provide non-medical support, education to pregnant and birth women and their families during and after childbirth. Doulas have been shown to positively affect the outcomes of mothers and babies. And that's from the National Partnership for Women and Families. But some of the key ways that happens, they lower the rates of preterm birth, C-sections, and low birth weight babies. Increase spontaneous vaginal births and maternal satisfaction with their birth or after giving birth, improve breastfeeding rates, and shorten labor times.
Thank you, Ms. Nanette, and thank you for joining us, jumping in here at the last minute. So I want to take a little time to talk about the history of the Mama Plus Health Policy Group. The Health Policy Group was instrumental in the Louisiana Doula Registry Board coming about. So it began in 2019. It's rooted in advocacy. The group got together in 2019, and when I say the group, I'm jumping around. It was members from the Institute of Women in Ethnic Studies, Birthmark Doula Collective, National Birth Equity Collaborative, and the Mandela Group. And we got together and we understood, based on the research and based on our experiences and our work in the area, we knew what the urgent needs were to address maternal health inequities, particularly among Black people in Louisiana, but also all women, whether it was maternal mental health, transportation issues, access issues, discrimination, mistreatment. We knew what the issues are, and we also knew from looking at our partners from around the country what were some best practices in improving those outcomes. The group got together originally to just look for doula coverage as a part of addressing the systemic issue. We know that doulas, as Ms. Nanette has discussed, provides support to families, and it helps increase breastfeeding, decrease some inequities, and improve just all types of outcomes. But we also know that there are other issues in our healthcare system that we need to address. So this Mama Plus group got together to just focus on doula registry, but it expanded to a greater, a long-term addressing the issue. And that is one of the reasons why, or the reason why Dr. Williams isn't here today, because she's advocating for more maternal health coverage for us in our state. So now let's go over the Doula Registry Board. So the Doula Registry Board, it came about, as Ms. Nanette talked about, with Representative Willard, already had some idea about what doulas are. And he wanted to do this policy that would help doulas, and also that policy at that time in 2021 was to help midwives as well. So there was a lot of back and forth, talking to stakeholders, talking to other policy makers, and what came about was the Doula Registry Board as the first step into getting doulas registered, getting doulas covered by insurance and Medicaid. I want to read specifically from the Act 182 what the law says, that the purpose of the board is. It says the legislature hereby creates within the Louisiana Department of Health the Louisiana Doula Registry Board. It says for the purpose of reviewing and approving doula registration to allow for health insurance reimbursement of doula services. The Doula Registry Board shall create the criteria for the registration application, review submitted doula registration and applications, and grant registration status to doulas seeking health insurance reimbursement to promote safe and equitable care for every mother and every birth in this state. I'm taking the opportunity to read that because I want to be clear of what the Doula Registry Board is and what it is not. It is not the policy group for doulas. It is simply to review application. Well, we set up the process for reviewing application and then approve that. The Doula Registry Board also is not a certifying body. So we maintain a registry for doulas seeking health insurance. We operate within the Louisiana Department of Health, although we're not employed, nor do we get paid for being on the Doula Registry Board. And I mentioned what the application process is. We also review applications during our 4 meetings each year. The registration or the application process opened at the beginning of this year. Prior to that, we were just working out, reviewing what the application process is. We wanted to make sure it's equitable. We wanted to make sure we include doulas from all over the state, but also doulas no matter what their training. Our board consists of 15 voting members. Those voting members are doulas and 16 non-voting members. But the representation of the board encompassing practicing doulas, doula service organizations. We have community representation, so that's including individuals with lived experience who receive care from doulas, healthcare professionals, state health officials, and the health insurance are also represented. Because we wanted to be equitable and make sure that there's representation better, let me say that, across the state, whether urban or rural, we do have 1 vacancy on the board for a doula in Region 7, the Shreveport area. Now, let's move on. So I talked about the Doula Registry Board, and now I want to talk about the Doula Registry. So the Doula Registry simply is a database of individuals who are registered, again, not certified, registered doula status in Louisiana, and makes them eligible for insurance payment for doula services. It does not mean that that if you're not on the doula registry that you can't practice in Louisiana. You can practice based on whatever your training. The doula registry is only for those who want to seek insurance payment. So doulas must meet all the requirements, and I'm going to talk about that in just a second. And the registered doula status is granted by the Doula Registry Board. So we make sure that the requirements are met, we meet, review the application, and approve those individuals that meet the qualifications. Moving on, our board meetings. So here are our meeting expectations. Prior to this year, we were meeting on a monthly basis because we had a lot to get together to work out the kinks with the application process. Currently, we meet 4 times a year. The meetings are open to the public. Members of the community can come to the meetings. They can make public comment, and address any matters that's set on the agenda. Community members also have the opportunity to put items on the agenda. So those need to be submitted to the chairperson at least 21 days prior to the meeting, and they can do that by emailing doularegistryboard@la.gov. The meetings are in person and virtual. However, to make quorum for the meeting, board members must attend in person. Ms. Annette, can you talk about the registration application?
Yes. The Doula Registry applications. The requirements for eligibility: you have to be at least 18 years of age, possess either a high school diploma or a high school equivalency documentation, be a citizen or lawfully authorized to be employed in the United States, meet one of the qualification pathways, experience, or training. Qualification pathways, we wanted to be really fair to all the people who have experience, as well as the training method and pathway, because we understand that doula training is expanding and changing as the years go by, and we want to make the pool of participating doulas across the state as wide as humanly possible. The experience pathway is requesting a submission of at least 3 recommendation letters from clients that were served within the last 5 years. Submission and proof that the individual had contracted and providing those services to at least 3 clients within the last 5 years. So you could have been trained 15 years ago, but if you wanted to get in through and you continue to practice over the years, we're asking, and you want the experience pathway, we ask those 2 routes for people. However, if you want the training pathway, you can demonstrate the certificate of doula training from that, but it must be from a board approved doula training organization. And we have criteria for that as well in the codes. The application instructions can absolutely be found on the Doula Registry Board website. Doulas must complete the application online. Once the application is submitted, the Bureau of Family Health will send confirmation to the applicant and review the application for completeness. For applications to be considered at the board meeting, it must be submitted at least 4 weeks prior to the meeting. Complete applications are sent to the board for review 2 weeks before the next board week meeting. At the board meetings, members vote on those applications. Applications will receive notification of acceptance or denial 2 weeks after the board meeting. Renewal and continuing education. That's you, Michonne, right?
Yep. Which is really simple. So again, we wanted to not make this process cumbersome, but we wanted to make sure that quality and the standard was there. So once you register, it is valid for 5 years. Doulas must submit a renewal application between January 1 and September 5th of the year that their registration expires. So if anyone registered this year, the next time they would have to renew is in 2030. Imagine that, you all, we're going to get in the 30s. So if the application is not renewed, the registration will expire on December 31st of the 5th year. So if someone registered today, they have to re-register by June 2030, and if they don't re-register, it'll expire December 31st, 2030. To be eligible for the renewal on the registry, you must demonstrate and provide proof of successful completion of 20 contact hours of continuing education. Again, wanting to make sure that quality and that standards are there. So here I'm gonna briefly talk about the continuing education. Again, we want to make sure that we talked about that safe birth practices. We want to make sure that the quality is there. So to do that, the activity must have significant intellectual, practical, or clinical content related to matters of maternal health care. So the board has gone through this process of what can and what cannot. That's all in our documents. Examples would be like attendance at conferences or meetings, if doulas present something during a course or a seminar, publication in national, regional, and statewide scientific journals, and then completion of academic coursework that's related to skills required for birth work. So not baking or not accounting, but it has to be something that you will need for your birth work. Ms. Nanette, you want to talk about the board-approved training organizations?
Yes. And I dropped the link in the chat for everyone if you want a link to those LDH administrative codes. And the board approved training organization begins on page 599, just for your information and resources for after the webinar. The organization, and I'll just go over them, we have it in the presentation, must have employees, board members, or consultants with expertise in doula, birth, and/or prenatal care. The organization must issue certificates of completion of training to individuals who have received their training. If the organization wants to have third parties provide doula training courses that lead to a certification of completion under the organization's name, then the organization must review and verify the training materials and check the qualifications for the third party. And I just wanted to say the one thing about third party is that in other words, your training source that you signed up with may be different from your certification. You may have been trained by Mary's Hand, but your certification and your certification exam is ICEA. Your certificate will say ICEA. So we have a lot of situations like that where people are trained. There are different sources, routes, even online training organization, but their curriculum and content and your certification will be with the content of that organization, like donor and things like that. The organization must agree to verify to the board upon request whether it has issued a certificate of training as a doula to a particular person. Some of the curriculum requirements: at least 8 hours of instruction. Examples of the topics, because they have the topics in the qualification in the administrative codes. Anatomy and physiology of birth and labor coping strategies and comfort measures, birth doula scope of practice, standards of practice and ethics, role of the birth doula with the members of the birth team, self-advocacy and empowerment techniques, communication skills, and active listening.
So why is this important for the community? And Ms. Nanette, I think we can tag team on this one. I'll start it off. It can be more of a dialogue for this one because I think there's more comprehensive information. So why the doula registry solely, like we talked about, is to make sure that doulas can get coverage by insurance. And we wanted to make sure that, well, a part of this process, we talked about making sure that the list is eligible or accessible to insurance companies. So they can just go into the registry, find the doulas on it, and see that they are registered, and it'll make it easier for them to be reimbursed. However, we know that doulas still have to go through the credentialing process with each of the insurance carriers. We wanted to, a part of the process of making the community feel increased trust and confidence in doula services due to the board's comprehensive application process. And again, this is a part of the process. Doulas are already working in the community. You've already built relationship with certain providers, certain hospital systems, certain patients. And so that also helps to increase the trust. But having this as like other professions, whether it's acupuncture, physicians, or nursing, so that individuals can see, or the community can see, that this is a reputable profession. This also is a part of the process to give a living wage to doulas. We know it's not the best. In looking at other states, there are higher reimbursements. And we don't set that as the Doula Registry Board, but we wanted to make sure that, or being a part of the process, to make sure that doulas are paid for their services, which is a lot of time in providing care to patients. Ms. Nanette, can you think of anything else to add about why is this important for the community?
It's important for the community because we've just made a path that is just non-traditional, and to also keep people abreast that there are that experience piece is so important because a lot of states don't have that. It's very limited to like a few training organizations, and new training organizations can apply, just like doulas can register. So we're in the mind frame of growing and being inclusive to as many people possible in the state who want to be reimbursed and who want to be trained and practice as doulas in the state. It's important that you do understand that the registry is not a certification or a license, that you should reach out and research those insurance companies in your parish that does reimburse doulas, and find out what their processes are, and see how you can get in network, or how the easiest path for you to do business with them to be reimbursed. Everybody has to get an NPI number, and there's several things that you do have to do to be reimbursed. The registration piece is just the beginning. And we wanted to make sure that the community and the people who attend this really understand that this is only the beginning. This is not the be all end all for the registry board. We're taking the applications. We're making sure people are trained by the appropriate and expansive doula board trained board approved training organization, sorry. But we do want you to know that as more training, or people receive training from other organizations, we want them also to fill out the paperwork online and apply and become part of the network that of doula
Yeah,
trainers.
and something you said made me think about. I just wanted to highlight. In some states, they only approve like certain training organizations. There's just a handful. We wanted to make sure that we were all encompassing, and of course, reviewing those training organizations to make sure that they also have the same high quality standard. But also, I wanted to add that during this process of advocating for the Doula Registry Board, we found that many policymakers weren't aware of what a doula is. And so this is why we need to make sure that the community feel that it is a trusted profession. And now I'll talk about why is this important for doulas. So for doulas, this is important for you because insurance companies, they have been at the table. Medicaid has been at the table. The Bureau of Family Health have been at the table. So observing our process, now they can be assured that when you register on the Doula Registry Board, it makes you eligible for insurance reimbursement. So you can get a good rate. It also makes it centralized so that families, other professionals, depending on if you want your information shared, so you can be visible to the community for the work that you're doing, so that can increase in your referrals. And the board set guidelines for the training and the continuing education. So in making sure that doulas have up-to-date information that is high quality and that they are providing care in a safe manner. And lastly, I want to talk about the hospitals. Why is this important for the hospitals and the clinics? So the same access, since it's public facing, the healthcare systems can access the list of doulas that are verified and see that these doulas are eligible for insurance reimbursement. This can increase your referrals. So providers can know where you are or what areas you're practicing in. And some doulas have additional certifications, whether it is breastfeeding, bereavement doulas, whatever it may be. They can also see that you have specialty services that they can also refer clients to you. And knowing that you accept the insurance, it'll make it easier for them to say what types of clients that they can refer to you. So just another marketing of sorts. With this enhanced coordination, what we really like about this is that we're hoping that the hospitals will continue to collaborate or increase their collaboration with doulas and make sure they know that doulas are part of the birthing team, that it's not just this outside entity, that we work with the hospitals, we work with the clinics, we work with the providers to make this overall comprehensive care team for the families in the hospital, but also an extension out of the hospital, whether that is during the prenatal period through the education and postpartum period through education and all of the supports that doulas provide to improve maternal and health outcomes. All right, Stephanie, I'm gonna turn it back over to you.
Thank you so much, Michonne, and thank you, Miss Nanette, for all of that content. And again, we'll save any questions for Michonne and Miss Nanette for the end of the presentation. We only have a couple of slides to go, so it won't be long. So we just wanted to share some opportunities for collaboration. So both with organizations and with the Doula Registry Board. So we just wanted to share, and some of you are participating, but the Louisiana Public Health Institute is convening a community of practice of maternal care providers focused on improved collaboration between doulas and other care team members. So people who participate are participants in the COP will identify opportunities to improve doula provider relationships through institutional level policy and workflow changes. So we have already been recruiting, and we have quite a few people who are already registered for the COP, but we still have a limited number of spots available for certain groups. So we have some spots available for clinicians, hospital and clinic staff, and payer organizations to participate. So for those folks, you'll have the opportunity to work directly with doulas, birth workers, and families to develop hospital, clinic, and organizational policies. And we want those policies to foster collaboration with doulas to create stronger care teams so that we can improve maternal health in our state. So this is the registration link. You can also take a picture of the QR code, and that will take you directly to learn more about the opportunity. So again, just a few slots left for our hospital and clinic administrators, clinical providers, payers, and also some birthing people as well, and families, because we want to make sure that their experience is part of the policy making process. And this opportunity is funded by the Packer Foundation and the Blue Cross Blue Shield of Louisiana Foundation. So thanks to them. And then I'll turn it back over to Michonne and Miss Nanette if you want to share more about the vacancy on the Doula Registry Board.
Yes, Stephanie, I mentioned this earlier, but we do have one open position in Region 7, which is in the Shreveport area. So if you know of anyone, or if you are someone that is interested in joining our board, it requires attendance at for the meetings in person, and they are in New Orleans. But I want to shout out, we have one of our members, CJ, I believe, who attends every meeting. It is a commitment, but we appreciate your time, and we are working to advocate to make it more accessible. The application link is here, and we can drop it into the chat as well. So if you have any questions about that, you can email the Doula Registry Board at la.gov. Again,
oh, go ahead, Michonne. I'm sorry.
No, this is our contact information for all of those that were represented today. You can either email us individually, or you can email the Doula Registry Board. And of course, we want to thank our partners at LPHI for doing the heavy lift of getting us here today. We appreciate you, Stephanie and Reagan, for all of your help to make sure that our slides were on point and we were ready to roll, and to your entire team.
Thank you. And just a shout out, thank you for reminding me to do that. So Reagan Carmena, who's our family health coordinator, also Mignon Holton, who's another family health coordinator who put together today's slides, and then John Mark Sharp, our director of communications, who has organized the Zoom and all of the back pieces that I don't understand how to do. So thank you to my team on that. And thank you, Michonne. Thank you, Miss Nanette. Just for your overall partnership, and for taking time today to present about either the opportunity to be a part of the Doula Registry Board, the application process, and just overall the history of how we got here. So we really appreciate your time, your talent, and thank you for sharing with us. So we'll see if we have any questions. Mignon, did we have any questions in the chat or the Q&A?
We have questions in the Q&A. Could podcast interviews count as CE credits?
I saw that comment, and we didn't specifically list that, but we have 5 years to come up with any additions. So I'll make sure to bring that back to the board to ensure that. So thanks for the question.
And then where can I apply for NPI?
So that is not a function of the Louisiana Doula Registry Board, but you can go on to Medicaid or to all of those providers to get your MPI number. We'll find a link for you.
And then when will you all notify registrants of approval for the COP?
I think that's for you all.
Yes, so we have some people who have already been notified, but we're still recruiting just another handful of participants. So I will say give us another week and we should have that finalized list. So I think what we're trying to do is make sure that we have representation from everyone at the table in the COP. So we want to make sure that we have doulas and other birth workers, hospital and clinic staff or administration, clinicians, people who I'll say have the power in the hospital or clinics to actually change policies and workflows that support collaboration. And then also payers. I know we have quite a few payers on the call, and I'm really appreciative that you all showed up today to hear from our presenter. So we want to make sure that we have representation from everyone at the table in the COP. So give us just a few more days to review our registrants, and then we'll finalize that list. So thank you to all of the current COP members who are here, and then we'll be in touch soon with additional acceptance letters.
And then the last question is anyone working on gathering info on what the current reimbursement rates are for different private and Medicaid providers? Or do doulas need to reach out to each company individually for that information?
Doulas need to reach out to each company individually for that information. There will not be a registry of sorts of insurance company standards, procedures, processes, because those things, it's a private industry and the Doula Registry Board can't regulate them. But we are encouraging all the doulas to make sure registry is just one part, registering with NPPE, I think it is. I dropped in the link, the MPI link, to register for and get information on that. But contacting the insurance companies is also as a provider, the provider pages for each insurance company in your parish. Please make sure that you do that.
I saw one more question come through in the chat. So is there an actual list of qualifying training programs for doulas aside from DONA? Does Sister Midwife Productions Best or Medriella, are they included?
Yes, they are on the Doula Registry Board page. I want to say board approved training organizations. There is a list, and Sister Midwife Productions is definitely on that list.
Are there any other questions?
We have
And
one more.
can I say one more thing? I just wanted to say that when you are getting information for the insurance companies, for example, if they require you to do something like take a CPR test, I think I saw something mentioned, or CPR class, or you have to take a CPR class for another current job or something else, those things can also be counted as CEU hours or CEU content. If you have to take something for like a for example, for a CPR class is a perfect example of something that would be considered as a CEU because it's safety and it's related to birth and emergency and health.
And Lynette, I think you addressed most of what Jenny is talking about, but I just wanted to add, I see your comment, Jenny. I think that might be something that we should advocate for, as far as that care provider component of your part of your question. Oh, Dr. Williams is here. So Dr. Williams, I was actually just recommending to Jenny, she had posted in the comments, she said, so far insurance companies are requiring anywhere from CPR liability insurance as well as being a care provider, which we are not. Some of us have not been able to move forward through that part of the process for reimbursement. while that is not something that is under the control of the Doula Registry Board, I think that is something that maybe you want to bring to the table at one of our Mama Plus Health Policy Group meetings, and together we can advocate on that language.
Yeah, thank you so much for bringing that up. We actually have a meeting scheduled with some paid providers to talk about this exactly. So, yes, thank you.
And welcome, Dr. Williams. Thanks for joining us right after the hearing. I'm not sure if there's anything you would like to add. We did mention to the group that you were called into the hearing about House Bill that was up for discussion today. So not sure if you want to provide either any updates about that or if you have anything to add for our presentation today. We were just wrapping up with questions.
Oh, yes. So it passed and it went through. So we are so excited. And it will go over to the floor for review as well. So,
Can you share a little bit more about what the House bill was that was up for hearing today?
oh yeah, today, just technical changes around board structure. Two main things. We were having trouble with, establishing quorum. And so we wanted to make sure that we continue to have the full representation from the 9 regions, but also incentivize or make sure that there's a reimbursable travel stipend or like some reimbursement for travel to make sure that people can make it to either Baton Rouge or New Orleans for our meetings. That was one of the main technicalities. Another one was the support from LDH, and they are wanting to be a part as much as possible. So one of the other technical adjustments was to allow a LDH member to be a non-voting member on the board, just to have some visibility from our state. But yeah, just purely technical.
Thank you for adding that. I talked about us having one vacant position and alluding to that we were working on something. This is the something. So thank you, Dr. Williams, for working on that. It'll make it a lot easier for those that are coming from Region 7 and 8 to participate in the meetings. So.
Yes. And hopefully a lot of you are already registered for our Community Growth Symposium on tomorrow and Friday, and we'll have another deep dive discussion. You can meet me in person and we can have a deeper conversation about this very same thing. I'll do the registry board. So hope to see you there.
All right. I'll give it another 30 seconds to see if any additional questions come through. All right, while we're waiting for that, again, thank you to our presenters, Michonne Sadiq, Nanette McCann, and Dr. Victoria Williams. Thank you for all of your insight, your experience, and what you bring to this work to improve maternal and child health in Louisiana. Thank you to our participants today for taking time to hear more about the Doula Registry Board. One other thing we're going to ask of you is just to complete a satisfaction survey. We appreciate your feedback. We want to make sure that we improve or that we met your expectations today, and see how we can tailor our work moving forward. So if you could just take some time to fill out the brief evaluation, and we'll make sure that we incorporate your feedback into any future either communications or webinars. So thank you everyone for being here again. We appreciate you all and your commitment to this work, and we'll give you 9 minutes of your day back. That's a win. All right. Thanks everyone. Y'all have a great day.
Thank you, Stephanie.
Thank you so much.